We've seen that sitting includes lying down when you're awake, but doesn't include activities like bicycling. What's the evidence that the total sitting time per day has any effect on your health? Let's take a closer look. This is the study. It's available in the resources section in PDF format for this lesson. It was published in the Archives of Internal Medicine. It is a prospective cohort study published in March 2012. They looked at over 220,000 adults and followed them for a mean period of 2.8 years. The outcome was that sitting for less than 8 hours daily reduces risk of death by up to 40%. They also found that meeting exercise recommendations to engage in 150 minutes of aerobic exercise per week and 2 sessions of strength training did not erase the risk of prolonged sitting. So you could be at a desk job and still, after work, meeting those exercise recommendations, but you would still have the increased risk in mortality if you were sitting for longer than 8 hours. Let's take a look at this graph to further unpack the data. On the x-axis is hours per day spent sitting. On the y-axis is risk of death during the follow-up period. Compared to someone who is sitting less than 4 hours, the risk of death increases, first gradually. Sitting between 4 and 8 hours, you're 2% more likely to die in the follow-up period compared to less than 4. But really the risk increases when you exceed 8 total hours of sitting on average per day. And 11 hours or longer is the highest risk. We've seen that there's a graded increase in risk of mortality with sitting, and the risk really begins to rise when you exceed 8 hours. We've also seen that doing exercise, even meeting the recommendations from the federal government to do 150 minutes of moderate intensity exercise per week plus 2 sessions of strength training, doesn't erase the risk from sitting.